Our research in the mid-1980s demonstrated the first activity for GLP-1. It stimulated insulin secretion and paved the way for GLP-1 medicines to be developed for type 2 diabetes. About 10 years later, we and others demonstrated that GLP-1 reduces food intake, and over the last few decades, we've demonstrated effects protecting the heart and blood vessels, reducing experimental stroke, improving heart failure, reducing experimental liver disease, and now GLP-1 is being studied for a whole host of indications, really expanding its opportunity to improve human health. The approval of GLP-1 medicines for diabetes really improved the outlook for people, since the medicines had a very low risk of producing a low blood sugar and also produced weight loss instead of weight gain. Over the last few years, we've learned that in people with type 2 diabetes, these medicines will also reduce heart attacks, strokes, the development of kidney disease, as well as death, really improving the outlook for people with type 2 diabetes. There has been a tremendous stigma associated with obesity, with many people, including healthcare professionals, placing blame on people with obesity for their challenges in losing weight. The GLP-1 medicines have shown the world that these people can lose weight. They just needed help. Just like we prescribe medicines for over 100 serious chronic disorders, GLP-1 has also helped people with obesity lose weight and also reduced the disorders such as heart disease and stroke and serious complications of obesity. So it's really been a major advance for people living with obesity. So looking to the future, the actions of GLP-1 on the brain, and specifically its actions in experimental and clinical addiction-related disorders, compulsive behaviors, substance use disorders, and neurodegenerative disorders such as Parkinson's disease and Alzheimer's disease, the science here holds great promise, and we have a large number of trials underway studying whether GLP-1 medicines will be potentially useful in these conditions, and I'm really looking forward to the results. So what are we working on now? I think that is most exciting is how GLP-1 produces its benefits independent of controlling the blood sugar and independent of weight loss. And targeting inflammation is an area of great activity and excitement in our lab. Looking forward, what I'm most excited about are new innovations in the field that will bring GLP-1 medicines to many millions of people who currently can't access these medicines, enabling the health benefits to be extended not just to rich countries that can afford the medicines, but to people all over the world who are challenged by health disorders that may indeed be benefited by expanding access to GLP-1 medicines.